Hi, everyone. I'm Dr. Katherine Harris, an assistant professor of neurology in the Epilepsy Division at UTHealth McGovern Medical School in Houston and part of the Texas Comprehensive Epilepsy Program. Today, we're going to talk about women and epilepsy and some of the unique considerations in this specific patient population. So the objectives for today are going to be to discuss the considerations regarding birth control for women with epilepsy, review the impact of hormones, estrogen and progesterone, on seizures, recognize how epilepsy and anti-seizure medications can impact pregnancy and breastfeeding, and describe how epilepsy can affect bone health. Almost 1.5 million women of childbearing age in the US live with epilepsy. There are many considerations throughout the lifespan from puberty to menopause regarding epilepsy. Meet Chloe. She's not a specific patient, but she's a composition of several patients that I treat. And she's going to help us go through some of the things that women encounter throughout the lifespan. So meet Chloe. She's 18 years old, high school senior. She had her first generalized tonic-clonic seizure after pulling an all-nighter to study for midterms. So she was pretty sleep deprived and pretty stressed. She went to the emergency room. She got blood work and a CAT scan of her head. Everything came back normal, the doctor said. So she was referred to a neurologist. The neurologist ordered an MRI of her brain, which was also normal, and an EEG, which came back abnormal. When the neurologist was talking to Chloe and her parents, it was discovered that she also had some brief jerks of her arms early in the morning that would cause her to drop her phone. These were myoclonic seizures. And her parents had also reported brief staring spells going on since elementary school. These were absent seizures. So putting together the different seizure types Chloe had, as well as her EEG findings, her neurologist gave her the diagnosis of juvenile myoclonic epilepsy, or JME. Typically, this type of epilepsy syndrome is well controlled with anti-seizure medication. So that's good news. But for the majority of patients with JME, they do need an anti-seizure medication lifelong. So this brought about a lot of questions for Chloe and her family. And we're going to go through some of those questions today. So first, will the anti-seizure medication interact with birth control? The short answer is that some do and some don't. Chloe was started on a medication called levetiracetam, which does not interact with other medications. But her question was, what if this medication doesn't work and I have to switch to one that does interact? So there's a couple of options in this case that could be considered. A non-hormonal intrauterine device like the copper IUD would be one way to get around the issue. Another option would be to use a second method of birth control. So a barium method in addition to an oral contraceptive pill, for example. Now, oral contraceptive failure rate is 3 to 6% in women with epilepsy versus 1% in most women. And some of this may be due to the medication interactions that occur. So it's important to discuss any birth control changes or questions you have with your doctor to make sure that you understand. So this is a list of some of the anti-seizure medications that can cause contraceptive failure. So you may be familiar with some of them, but you might not. Carbamazepine, clobazam, eslicarbazepine, oxcarbazepine, phenobarbital, phenytoin, primidone, and rufinamide all could cause contraceptive failure. There are some anti-seizure medications that can cause contraceptive failure when they're used at higher doses. So it's a dose-dependent response. The more common one is probably topiramate among this group, and perampanel might be another one that you've seen, but that one is a little bit newer. There's not a whole lot of people on felbamate, but that's included in this list too. There's also several medications known not to interact with birth control. So there's a lot to choose from. And you may be familiar with some of the ones on this list as well. So levetiracetam is the one that Chloe started. So now looking at this from another angle, will birth control interact with anti-seizure medication? Again, some do and some don't. In Chloe's case, birth controls, including oral contraceptive pills, don't interact with levetiracetam. There are some medications like lamotrigine where the level of the seizure medication can be affected by the hormones in the oral contraceptive pills. So estrogen-containing OCPs, like the pill, the patch, the vaginal ring, using those in conjunction with a medication like lamotrigine could result in a lower level of lamotrigine in the blood, thus increasing the risk of seizures. So your doctor may want to check blood levels and increase your lamotrigine dose, and may or may not ask you to use a different method of birth control. Progestin-only OCPs may increase the level of lamotrigine in the blood, thus increasing possible side effects. Considering a non-hormonal IUD like the copper IUD can circumvent this whole hormone interaction issue. So if you're not looking to have children anytime soon and you're looking for something a little more long-term and not have to worry about this, that's a good option for some patients. Will my seizures increase during my menstrual cycle? So catamenial epilepsy is a term that you may run across. Essentially, this is a cyclic exacerbation of seizures due to monthly fluctuation in hormones. So essentially, at the same time every month when the hormones change, that's when the patient is having their seizures or an increased frequency of their seizures. This pattern actually affects 1/3 of women with epilepsy. Estrogen and progesterone affect the excitability of neurons, also known as brain cells, and thus they affect the risk of seizures. So the easiest way to break it down is to consider estrogen as a proconvulsant. So it increases the risk of seizures. It makes the neurons more excitable. Versus progesterone, which is an anticonvulsant, and it actually protects. Progesterone protects from seizures. So when a patient thinks that they're noticing this pattern, one of the important things to do is to try to track it. So keeping a seizure diary, tracking seizures in relation to the menstrual cycle and any other possible seizure triggers is really important. If this pattern still is there in the seizure diary, and depending on which part of the cycle it is, that can help guide different treatment options to address it. So some of those options might include increasing the anti-seizure medication dose on or around those menstrual days, or adding an additional medication on or around those menstrual days. Another possibility is progestin-only forms of birth control. Sometimes that's helpful. So let's go back to Chloe and her course. So Chloe started anti-seizure medication and she did great. Her seizures were controlled. She went on to complete her bachelor's and master's degrees, and then she's now working. She and her significant other are discussing the timing of when they may want to have children in the future. So this has brought up a whole host of other questions. So Chloe's first question, will I be able to get pregnant? 24,000 women with epilepsy become pregnant every year. There is a higher rate of reproductive disorders in women with epilepsy. This affects 33% of women with epilepsy versus 12 to 14% in the general population. However, there was a recent study that compared a group of women with epilepsy without previously diagnosed fertility issues to women without epilepsy. And there was actually no difference in the ability to achieve pregnancy or the birth rates between those two groups. Will my seizures increase during pregnancy? The best predictor is the level of seizure control before pregnancy. It's still possible for seizures to increase, decrease, or stay the same, but ideally you work with your doctor well before pregnancy to get the best seizure control possible. Changes in the body during pregnancy can affect the level of anti-seizure medication in your blood. So there's hormone changes, there's increased blood volume, the rate of medication clearance through the kidneys, all those things can affect the levels of the anti-seizure medication. So the American Academy of Neurology guideline is to check levels of anti-seizure medication before conception and monthly throughout pregnancy to guide those changes, to try to keep the level at the target that was controlling your seizures before pregnancy. So it's important, if you find yourself pregnant, to let your doctor know so that they can get those blood tests arranged for you. And ideally, you've talked to them before you know you're pregnant, so that they've got on file a recent blood level to conception as well. How important is it to continue my anti-seizure medication during pregnancy? The short answer is it's very important to prevent seizures during pregnancy. So you should continue your seizure medication. Seizures during pregnancy increase the risk of preterm delivery and low birth weight. You should always, always, always talk to your doctor before making any changes to your anti-seizure medications. So if you find yourself pregnant, call your doctor. Don't just stop your medications. Prior to conception, your doctor may want to adjust some things to try to optimize health for you and the baby during a planned pregnancy. So they might talk to you about switching medications to pick one that decreases the risk of any types of birth defects potentially. They might also try to decrease the dose or to decrease the number of medications. They'll probably check the level of medication in your blood as well, so that you have that as a guide throughout pregnancy. And they'll ask you to take folate, folic acid. This is a vitamin that helps prevent birth defects. So will my anti-seizure medication cause birth defects, and which medications are safest? So this is a table from the North American Anti-Epileptic Drug Pregnancy Registry. And women who have been pregnant while taking different anti-seizure medications are in this registry, and that's where this data comes from. So the two medications that are most commonly used during pregnancy that we have a lot of data for and that have fairly good safety data are lamotrigine and levetiracetam. So lamotrigine has a 2.1% chance of major congenital malformations and levetiracetam a 2% chance. Now, compare this to someone who's not on any anti-epileptic drugs. They're not on any anti-seizure medications. That's at 1.6%. So it's a very small difference. So these are the two that we like. Oxcarbazepine also has a fairly good number here at 1.7, but we don't have quite as much data for that one. And these other two that are coming in a little lower, we don't have as much data for. So the favorites tend to be lamotrigine and levetiracetam, probably followed by oxcarbazepine. That being said, some of these other medications, let's take carbamazepine, for instance, it's at 3%. So you and your doctor might talk about switching to another anti-seizure medication, or you might talk about 3% being an acceptable risk for you and your partner. So some of these other ones that are higher, like valproic acid, has a risk of 8.9%. So that would be a time when your doctor is very likely to talk to you about trying to switch to a medication before you're pregnant to decrease that risk. But every case is different. And the most important thing is to control your seizures during pregnancy, because if you have seizures throughout pregnancy, that could be worse. Will my child have epilepsy? So for many types of epilepsy, the risk of passing it on to your child is low and shouldn't prevent you from having children. However, there are some types of epilepsy with a genetic cause that can be passed on to children. So really, to answer this specific question, you need to discuss with your doctor and a genetics counselor to look at your specific kind of epilepsy to understand the chance of you passing it along. So in Chloe's case, typically someone with JME wouldn't pass it along. Should I breastfeed? Generally, the benefits of breastfeeding outweigh the risks. So the benefits for the baby include a decreased risk of lower respiratory tract infections, decreased ear infections, and atopic dermatitis, decreased asthma, decreased gastrointestinal issues, decreased diabetes, decreased obesity, and decreased sudden unexpected death. So lots of benefits for the baby. It's also been shown that it might increase IQ and verbal ability. There's also benefits for the mother. Mothers who breastfeed have a decreased risk of developing breast cancer or ovarian cancer, decreased risk of diabetes or postpartum depression. For most anti-seizure medications, the amount of medication transmitted in breast milk is much less than the amount the baby was exposed to while they were in utero. So during pregnancy, the baby's essentially swimming in the stuff. The benefit to breastfeeding is thought to outweigh the risk. There are a couple of possible exceptions. So one example of this would be barbiturate or benzodiazepine classes of medications. And these might cause sedation, weight loss, and higher medication levels in the child than the mother. So essentially discuss it with your doctor. And it may be a straight yes, you should do it. It may involve checking some blood levels to in you and the baby and make sure things are okay. But in general, the benefit outweighs the risk. So going back to Chloe's course, Chloe began taking folate prior to attempting to become pregnant and worked with her doctor to make sure her seizures were well controlled. Her doctor checked the level of her anti-seizure medication in her blood prior to pregnancy. Chloe let her doctor know the good news when she became pregnant. She got the medication level of her blood checked once a month throughout pregnancy, and the dose was adjusted accordingly to ensure that her seizures stayed controlled throughout the pregnancy. Chloe gave birth to a healthy child. She chose to breastfeed her child after having conversations with her doctors. Her anti-seizure medication dose was able to be decreased back to the dose she had been taking prior to pregnancy. And Chloe continued in her family life and her career and continued to follow with her doctor. Chloe is now approaching menopause and has more questions about what to expect. So what should I expect during menopause? During the perimenopausal period, there's initially a decrease in progesterone, while estrogen levels remain high, and this combination can increase seizures. Remember, progesterone protects, and estrogen will increase seizure risk. So your doctor may need to increase your anti-seizure medication during this time, but not always. During menopause, seizures stabilize, with most menopausal women reporting a decreased seizure frequency. One caution would be that hormone replacement therapy can increase seizure frequency. So remember to discuss that with your doctor. What about osteoporosis? So osteoporosis is decreased bone mass or bone strength. And this is something that's encountered commonly with aging. There are risk factors for osteoporosis, including just being female, but also being postmenopausal, leading a sedentary lifestyle, so not a lot of exercise, high alcohol consumption, smoking, and inadequate sun exposure. There are some anti-seizure medications that can increase the risk of osteoporosis. So Chloe has actually been taking a calcium and vitamin D supplement throughout most of her life, as these are important to help maintain strong bones. There's also something called a DEXA scan that can be used to monitor bone mineral density. And at this point, that's something that her doctor would like to order. So if the bone density scan comes back showing osteoporosis or osteopenia, there's a few strategies to help with that. If it's osteopenia, it might just be as simple as getting the appropriate calcium vitamin D supplement. But if it's osteoporosis, you might actually need a prescription strength medication to help strengthen your bones. So something called a bisphosphonate. And your doctor may also discuss with you changing your anti-seizure medication if it's one of the medications known to affect bone strength. So which anti-seizure medications are safest for bone health? So lamotrigine is an example of one that is not known to affect bone health. There are a couple of others where it's a maybe. So the levetiracetam that Chloe takes is a maybe. Same with topiramate. But there's several medications that we know affect bone health. So carbamazepine would be an example of a common one, phenytoin. Anything on this list with a yes, those are ones that we know affect bone health. So it's important to make sure calcium and vitamin D are at the levels they need to be throughout life to prevent that issue. And then it's important to monitor for that, particularly as people get older. Back to Chloe's course. Chloe's doctor had to increase her anti-seizure medication dose during perimenopause, but was able to decrease it again post-menopause. Her doctor has monitored her calcium and vitamin D levels, as well as bone density scans. She's been able to maintain strong bones by taking calcium and vitamin D supplements, limiting her alcohol intake, and doing weight-bearing exercise. This is particularly important to Chloe because osteoporosis runs in her family, and she wants to prevent bone fractures due to any falls that may occur as she ages. So some take-home points for today. There are important considerations for women with epilepsy that differ from men with epilepsy. You should always discuss birth control, pregnancy, breastfeeding, and your bone health with your doctor. Many women with epilepsy are able to lead healthy lives and achieve their goals with help from their doctor along the way. I hope this talk was helpful, and thanks for listening, everybody.